Okay, ready?
Next. Go on. No, not a good question.
First question.
I think we yell at them.
Okay. Okay, rapid fire questions. First question. What's your pet peeve in the OR?
Okay, so what's my pet peeve in the OR? My pet peeve would be working with people who are not high achievers. And so, I think all surgeons have experienced working with someone, a nurse or a tech, who's just not interested in the procedure. And, I want my whole team dialed in, and I want to be working with, all high achievers that, mimic the passion and the dedication that I have for my patient. That's why I work with the same team over and over, because I feel like you need that high level of dedication and passion for every case, and your team members have to know kind of your next move before you even make it.
Second question, scalpel or syringe?
Question is scalpel or syringe, and I think it's not either or. So patients who are younger, who are looking for some type of facial rejuvenation, fillers and Botox are excellent options. However, once you reach a certain age, then it becomes a scalpel. So I think it really just depends on the patient and what they're actually looking for and their overall expectations, but it can be either.
Last question, what's one thing that you secretly judge in before and afters?
Yeah, so what's one thing I secretly judge in before and afters? Well, it's not just one thing. It drives me nuts when I think lighting is off, and it's really hard to get standardized photos. We even struggle with that ourselves, but we pay a lot of attention to that, making sure that the lighting is the same, the same camera is used for the before and afters, because you can tell a difference. And for face procedures, definitely the position of the face, whether it's tilted up, tilted down. There's some little tricks that people can do to be sneaky in the after photo, making the after result look better. So, just really lighting and the positioning of the patient.